in.
Emergency room nurses, and she's going to talk about the trauma room.
Come all the way in, everybody. All the way in. There's plenty of room. Good morning, everyone. Thank you for coming. So this is one of our 2 trauma rooms that we have here in the emergency department. The other one is right next door. They are identical with the exception of this one has a pediatric crash cart in it and the one next door has an adult crash cart in it. That is not meant that they are exclusive, however we interchange them and use them however we need to at any moment in time. The one nice thing that we have found about the rooms is the sheer size. We really need a little room when we're taking care of critically ill or injured people. So this room provides us with that, and it has been great. The doors here open up extra wide as compared to the rooms in the doors in the other rooms. We can get equipment in and out quickly, we can get our patient in, we can get staff in and out, but they still always close completely for patient privacy and family privacy, which we're also very thankful for. Another nice thing that we have in this room is the monitoring system. The monitor is the same as the system in the rest of the emergency room, just a little bit bigger. They put this one on a boom, however, and the boom can be used anywhere around the bed that we need it to go. It's completely mobile and can end up over here if we really need it to be. The doctors and nurses can get the equipment, the suction, oxygen, the monitor, or electricity very easily at hand just by moving that. The other nice thing about this room is the lighting system that we have. The lights are the same as, or similar to that used in an operating room. Sorry. Okay. The lights are meant to be used for fine detail work, as suturing or exploring wounds. They can be focused to an area as little as the hole in the top of my hand, and they can be made as big as the patient themselves. They produce an ambient heat, which also keeps the patient warm, because trauma patients need to be kept warm. The trauma room itself is great because everything that we should need to take care of anybody that's critically ill or injured should be in these rooms and kept in the cupboards. The cupboards are identical as the room next door. They're labeled. Every nurse in the department should know where everything is at the drop of a hat. We check them twice a day to make sure we have everything in them that we need. Anybody have any questions?
We'll move this in, and it's called our fast track area. And what's very impressive to me about this is that this used to be our old emergency room. So you get a scope of the expansion that we have. And I'll turn it over to the 2 nurses here to tell you a little bit about the fast care area.
Hi, my name is Cindy and this is Deb, and we're both 2 night nurses, so kind of rare for us to see the light of day in this department. But as Tim said, this used to be our old emergency room, so when you look at what we've done, the old emergency had anywhere from 12 to 16 beds depending on the fast track, and now the whole department is 27. But in this particular area, it's 6. This is our fast track area. And this area is typically open from 10 to 10 or 12 to 12, depending on the day of the week. We staff it with a physician's assistant, a nurse, and a tech. We have everything in this whole area that everybody else has. We have access to the x-rays that they do. We can do lab work by sending it to the lab through the tube system. The rooms are set up identical to the areas in the trauma area and the south wing. So if we have a fast track, if we have a medical patient that comes in that needs a bed and they're full, we can use this area also. Typically the fast track patients are the sore throats and the earaches and the toothaches and things that just require to be seen by a doctor, get a prescription, and they usually are quick in and quick out. And that's why we have this area designated for that, so those patients don't have to wait. We have doors on the rooms where the old area had curtains, so it's helped decrease the sound as well as increase privacy, and the patients have been thrilled with that. It really has helped a lot.
Does anybody have any questions?
Well, thank you for coming.
Thank you
You
for
want to follow me this way? We'll go back out into the lobby.
Thank you.
That you'll need to take. What we were challenged with in our community is that at 2 o'clock in the morning there might not be a lot of 24-hour pharmacists available. So we have what's called the InstiMed machine. So our patients can come, they'll get a script with a barcode on it from the physician, a prescription. They can come in and feed that prescription into that machine, and then that machine will cover and give them that prescription so they can go home. They don't have to leave here and go to another pharmacy. And it takes your credit card or your insurance card. It's all right there in that machine. Almost 90% of the medications that you'll need when you come to the emergency room are in that machine. And that varies depending upon the season. Like, we may have more allergy medications as you get into the fall or something along those lines. And our pharmacists do the quality control, the quality checks on that. I mean, there's several quality checks within that system, but it makes it a one-stop shop. So when you leave here, you can have your prescription as well. With that, thank you very much for coming on our